Hey guys, welcome to my new podcast series, Your Health You Care. Hello everyone, welcome to my podcast, Your Health You Care. Today I'm going to talk about the tetanus vaccinations in case of minor injury or any kind of injury domestically or wherever. Very frequently asked question in the clinics. Hey doctor, I got this scratch, some bleeding is happening, I got a minor cut in the kitchen, in the field, during sports. Is it mandatory for one to have the tetanus vaccine? Well, the routine practice is to administer the tetanus vaccine intramuscularly within 24 to 48 hours of the injury. These are the protocols, I think, across the country at least. And so the answer to that question is yes, you should get the tetanus toxoid vaccine, considering you do not know the history of immunization against tetanus and you haven't had any injuries in the past 5 years, 10 years, and you do not recall if the first aid doctor or emergency doctor administered you with the tetanus vaccine or not. In those scenarios, yes, you should be taking the vaccine. But there are so many follow-up questions that must be answered, and these questions do not only come from the patients but also clinicians, that what should ideally we do about tetanus vaccines in a case where somebody is completely vaccinated. For example, a child who has completed the course of vaccination through their immunization centers. Well, in that case, for children, if they have hit all the timelines on their vaccine card and completed the vaccination up to 6 years around, then you are immune against the tetanus for up to 10 years of age. So after 10 years of age, again, there are protocols to get the booster tetanus toxoid vaccinations, and 5 years to 10 years around, you are covered with those booster vaccines. So for example, if a child is coming to the clinic with minor injury, minor bleeding, and exposure is metal, old metal or some other dirty surfaces, then you should be asking the immunization history. When was the last tetanus vaccine done? And if the answer is not clear, go ahead with the vaccine. If the answer is clear that okay, we have had the vaccine in this time period, then you're fine. Then you do not need to administer the tetanus vaccine. And another example for adults. For adults, if you have had the vaccination, and then most of the time in adults, routinely they get vaccines combination with other vaccines, diphtheria and pertussis. There are multiple packages that you get in one shot: tetanus, diphtheria, and pertussis. So if someone had the vaccine in the last 5 to 10 years, then you are again covered. You don't need the another injection for the injuries. Rule of thumb is 3 years for tetanus. So if you have had the vaccine administered in the last 3 years, then you do not need another vaccine. Some research suggests 5 years, and most research suggests 10 years around. So if you have had booster tetanus vaccine in the last 10 years, then you do not need to frequently administer the tetanus vaccine for that particular 10 years period. But again, the question sometimes come as, hey doc, I had the tetanus vaccine, and in last 10 years I have had. So out of curiosity, I want to know what will happen if I get another vaccine during this period, or let's say I don't remember, I am not sure whether I had the vaccine or not. What to do in that case when you are not sure about the timelines of the vaccines? Well, in that case, again, it's pretty safe to get the vaccination intramuscularly, because I think the body receives vaccine in a form, in a very little quantity, microscopic quantity, and the anti-toxin antibodies or serum are released in the blood for quite some time, and it won't be lethal if you take the vaccine again. But how again, how frequently? Let's say in your lifetime you should not be getting anything more than 10 injections or so. So it's a common sense of idea that if you're not sure, then go ahead, take the injection, that's fine. There won't be any side effect or adverse effects if you are administering it that frequently, but do not administer on each and every event. So that doubt is clear there. And another query is, hey doctor, I had a cut from the glass, I had a cut from the plastics, I had cut from the toys or paper cut and all of that. So should we go ahead and get the vaccine? Well, the idea here is to prevent you from the tetanus infection. Tetanus infection, the bug, the Clostridium tetani, it is sitting on multiple surfaces, most frequently on the old metals, but on the glass surfaces also. It may be sitting there also. It may be sitting at any possible corner. So in any kind of confusion, the exposure history is not clear, you should ideally be revising your vaccination history, and if required, administer. And again, queries come, hey, I just had a scratch, but there were no obvious bleeding, what to do? Well, then in that case, just cleanse with soap or running water, and then if there is no bleeding or any visible skin exposure, then I think you should be fine. But in cases of very old erosed metal, corrosive metal exposure, and then suspected scratch, and you feel that okay, if you look through the microscope you might find a drop of blood or something, a point of blood, then go ahead again, do the vaccination, tetanus vaccine. You can find this vaccine everywhere, in every little clinic to big hospitals they have the vaccination. And sometimes folks will ask, hey doctor, I'm going to go through a major operation in the operation theater under general anesthesia. Doctor would be using all metal equipments. Would they be considering the tetanus injection? Well, the answer to that question is yes. During the history taking period, the questions will be asked to you whether you had the tetanus vaccine or not. If there is no clear history, then most likely routinely they would be giving you the vaccination. Other than that, majority of the clinical arguments revolve around the duration and the validity of the vaccine, that I already cleared, that the safest is 3 years you are covered since last vaccination, and in the practices 5 years to 10 years are fine, so you should be covered with that. Other questions that could come with the tetanus vaccine, that hey, what could happen if I get the tetanus infection? Well, majority of the symptoms would include the muscular pain, spasm, locked jaw, and other complaints relating to your physical activities. And with thorough history, doctor can clearly identify. If you tell them that oh, you had an injury, they can identify you have tetanus, and for the lab test they can test your blood for that. So testing the blood will clearly see the toxins amount in the blood, and then they can tell you quantitatively whether you have tetanus injection or not. How bad that can happen, that depends individual to individual. If an individual is immune compromised, the results would be different. But general awareness about the tetanus vaccine, routinely for prevention, for Prior to the injury, if you want the vaccine, I would recommend you take the combination diphtheria, tetanus, and pertussis boosters. You can take every 10 years, and after injury, as soon as you can take is better for you. And another, when I was reading all of this and discussing with colleagues and friends, we figured that also majority of the tetanus vaccine that you take, they help you with the further injuries, they help you with future injuries. So the current or recent injury, the effects compared to how the tetanus vaccine can help you, the future and further injuries will be prevented much better than this particular administration as compared to the current injury. That doesn't rule out the possibilities. So go ahead and get the vaccinations routinely if you do not have any clear history known. If you have any other questions or queries, you can always reach out to the Informal Doctor YouTube handle, Informal Doctor Instagram handle, and you can also email, reach out to me, and you can contact me through all means. All the best, take care, and have a great day.